and I'm the Whoop. Thanks, Sabrina. Good afternoon. Hey, Carla. Good afternoon, everyone. My name is Kelly Cannon. I'm the CEO of the Virginia Hospital and Healthcare Association Foundation, and we're excited to be here sharing lunch time with you all today. Thanks to the generosity of our funders, which includes the Virginia General Assembly. VHHA Foundation has been proud to partner with VNPC as well as VDH over the past several years to address the disparities impacting maternal health outcomes in the Commonwealth. So we're excited to be here with you today to talk about a new initiative that we're launching together. We have recently formalized a partnership with the U.S. Centers for Disease Control and Prevention to offer the Levels of Care Assessment Tool. This is also known as LOCATE for all birthing hospitals in Virginia. This is an evidence-based assessment tool. It was developed by national experts to help hospitals identify gaps in risk-appropriate care systems, assess personnel and equipment, and develop and implement quality improvement initiatives to better meet the needs of local communities. We will say the following statement many times over: this is different from the Joint Commission. LOCATE will be used for public health and quality improvement purposes only, not for regulation or for a formal designation of care. These results will be confidential. They're shared only with the survey organizations, which is VHHA Foundation and VNPC, and with the individual hospital representatives. We will not share the results with any other hospitals, with any government or regulatory entities. I might make you repeat that back to me at one point, just so that everybody is clear on that part. Participation in LOCATE is free and voluntary, and we're hoping that all birthing hospitals in Virginia will take advantage of the opportunity. We want to use this tool to help learn and improve outcomes for our patients. The information that we can glean from this assessment will help inform us about Virginia's capacity to provide perinatal care, particularly among high-risk populations. So today we're joined by Dr. Carla DeSisto with the CDC's Maternal Health and Chronic Disease team. She's going to share more about the LOCATE tool and how we are issuing the assessment right now. So Carla, thank you so much for your partnership and support. We're thrilled to have you here with us today and excited to introduce you to maternal health leaders from across Virginia.
Thanks so much. I am so sorry. I've been having all kinds of tech issues. Zoom wouldn't let me join, and now I'm going to keep my camera off because it kept kicking me out. But thank you so much. It's so good to be here.
No problem. Glad to have you. I think with that, let's see. I know that Shannon from VNPC was going to pop on. I don't see her on here right now, so I think we can dive right in. We've instituted this as kind of office hours as a chance. All of you who joined, that means if you're here, you've probably gotten the letter, the invitation to participate in LOCATE. Hopefully you had an opportunity to review the questions that are part of the assessment. And we're here to answer your questions, provide more information about the background, or dive into any specifics. So Carla, are you planning to share the slides, or do we want to just dive right into questions?
Yeah, I didn't know, Kelly, if most of the folks on this call saw my slides from a couple of weeks ago. So I didn't want to be redundant. So I'm happy to just take questions if that's helpful, or if people need a refresher, happy to do that. Basically, whatever would be useful to the folks on the call works for me.
Okay. I'm going to say this. We're going to open it up for questions, but anyone can feel free to raise a hand and say, hey, let's get a little more background information on this, or I'm looking for more content. So. Has anyone taken a look at the questions? Have you gotten started at your hospitals? I see a nod from UVA. Wonderful. How's the process going so far? I know it involves some collaboration with multiple departments.
Yeah, pretty straightforward. We have gathered the majority of the information, just need to make sure our numbers are checked and double checked before we submit. Some of it might take a little bit more effort to glean out of the EMR in terms of the stratifying below 32 weeks or below 1,500 grams.
Excellent.
And I'll just note, if there's something that, I realize the statistics questions are set up that they are required. If there are issues that you have where you just can't get some of the data, especially stratified into those smaller groups, if I would just ask that you enter 4 9s in a row, so that I know on my end that it's an error. And you can consider that, I don't want people spending hours and hours of their time over one of those if it's just going to cause frustration and take a lot of your time and resources. So just again, 4 9s or more 4 or more 9s would be helpful.
4 or more 9s indicate you don't have that data. Is that right, Carla?
Yeah, or we can't get it for whatever reason, but it's basically the equivalent of missing. I think we have it set up right now that you have to enter something to go to the next question.
Okay.
Fair enough. Thank you.
That's great guidance. Thank you. Carla, maybe you could talk a little bit about just the scoring process, the assessment, like what happens. So it sounds like UVA is pulled together, they've pulled together the team, they've analyzed the questions, they've sent it out to various departments, they're analyzing their EMR, they're going to submit the assessment. Can you talk us through the process of what happens next?
Absolutely. So after all of the hospitals in Virginia participate and finish submitting their data, I will receive an export. It's a CSV file, so each hospital will have their own row of data, and I'll have everything you entered through the locate process. It will be totally de-identified. This is super important. CDC does not get, I will not know which row of data is UVA, for example. After I receive the totally de-identified data, I will be able to run it through a standardized SAS algorithm that I have on my end. And Dr. Lindsay Womack is also on the call, and she will also be kind of working with us if I'm in my 3rd trimester. So if I have the baby before I get your data, Lindsay will be doing this. And the algorithm is set up exactly how the questions from AAP and ACOG are written in the guidelines. So, for example, you'll report if you have a neonatologist. AAP says you need to have a neonatologist for levels 2, 3, and 4 with different availability for those different hospitals. And our algorithm will run through and basically say for each question, here's like the maximum level that your hospital can be at. And then through kind of a standard process, at the end, you'll get a level of neonatal care and a level of maternal care. What you'll also receive is, because you self-report which level you think you're at, we will look and see if there's a discrepancy between the two. So let's say you think your hospital is a level 4 NICU, and our algorithm shows it's a level 3. We'll actually then write out what you're missing to be a level 4. So maybe your neonatologist isn't available 24/7. So you'll actually get like a handwritten note from either Lindsay or I that spells that out for you. In some cases, about 25% of cases when there's a discrepancy, it's actually the opposite. So somebody will say, we think we're a level 3 and you're actually a level 4. I can't write a similar discrepancy there because I don't know what made you think you were only a level 3 as opposed to a level 4. So you'll just receive a note that says like locate assessed higher than self-reported level. Does that help?
Yeah, very much so.
I think that's one of the, when VNPC and VHHA started kind of exploring the opportunity to administer the locate tool, that technical assistance and specific feedback on the metrics is really what drew us to this. And that's where we see this as a QI tool, is for you to really be able to benchmark against peer institutions and dive in more specifically. And I think that what comes out of that can be actionable, and you may determine that's not a priority for us, or, well, that may be something that we need to build into the budget, that we need to work towards in the future. So I think that's kind of exciting.
Can I ask a question about using the designation?
Absolutely.
So let me try to phrase this well. There are other states that are further along in implementing levels of maternal care than Virginia is. Although I think, I'm glad we're diving into this when we are. And the leaders have specified that, the information is not going to be disseminated. In states, either where it was mandated by the legislature that levels of maternal care be implemented or where they have done it, have you seen centers use the designation as a a part of their information they provide to patients and other referring centers about care that's available?
That's a really great question and is a little complicated. So I'm going to answer it the best I can because every state has things a little different. I will say, first and foremost, that locate is not a formal designation of levels of care. It's an assessment of levels of care, and it's based on AAP and ACOG guidelines. However, it does not incorporate a site visit, for example, and it does not include every single criteria that AAP and ACOG lay out, because we tried to focus on the things that most separate the levels so that it wouldn't be much longer, basically. So it's very important to us that a hospital doesn't say like, we have a CDC locate designation of a level 4 because you don't. It's just an assessment. And, you know, there are processes if you, for example, if your facility wanted to work with, let's say, the Joint Commission and do a levels of maternal care verification and, you know, came out as a level 4, and then you wanted to hang up a billboard on the interstate or advertise it to patients, you are able to do that with their process, but that's very different than what Locate is able to provide. And we very much will reiterate over and over again that it's not a formal designation of care. That being said, there are states that have, you know, mandated in the legislature that they are implementing levels of maternal care similar to levels of neonatal care, which are much more established. And in different states, there are different processes for being like an officially verified level of care. So it's not only the Joint Commission, for example. There are states that are doing their own internal state site visits and verifying levels of care and then giving some sort of designation. So again, it kind of varies state to state, but I think the biggest takeaway is Locate in and of itself does not constitute a designation.
I think that's important, and thank you for clarifying that. I think that obviously it's going to be up to VHHA leadership to determine how this information is used statewide, but it seems like perinatal regionalization could be one of the utilities of this information, even just based on the Locate assessments and how closely they seem to match up with your tool that you'll apply, Carla, in terms of each hospital's self-assessment. And I know that regionalization can be a dirty word sometimes because it sounds anti-competitive, and it's less of a issue in my region of the state where the next nearest high-level, perinatal center is 80 miles away. But in an area where the marketplace is more competitive, I can see that's an issue. You know, if you're in a geographic region where there's more than one level 3 or level 4 center. So thank you.
Absolutely. I see a question here. Are all NICUs in Virginia participating in the Locate assessment? Is it voluntary or mandated? It is not mandatory. So this is a voluntary opportunity to self-assess and benchmark against your peers, to kind of take a look at your internal processes, programs, service lines, and analyze how they stack up against these levels of designation. It is entirely voluntary and not going to be publicized. We're not going to put on the VHHA website, level this, level that, hospital this, hospital that. Yes.
And not limited just to NICUs. I mean, that question
Correct.
was specific to asked about NICU, but
I see.
you know, in our health system, we have two other facilities, one of which has a NICU, the other doesn't. And so we want to, pursue, this assessment for all of them.
Yeah.
Yeah, and I'll just add, I know we have Locate set up so that you can choose to either skip the neonatal or skip the maternal sections. For most facilities, I would recommend doing both. But I understand, for example, sometimes children's hospitals don't really have like full like labor and delivery units. They might deliver a handful of babies a year, but really they're assessing their NICU, and then there are other hospitals that maybe really focus on the maternal side for whatever reason. So that is an option. And then the other thing I wanted to mention is a lot of health systems will have multiple hospitals, and we generally recommend that each hospital complete the assessment individually, because you start getting into those issues of like, well, this hospital has a neonatologist and this one doesn't. And like, we could call him or her if needed, but that's kind of different than having someone there. So I just wanted to bring that up as well.
I just had a quick question. Since I know you said that the names aren't going to be, attached to the levels of designation, will there be any information disseminated to everyone about, even if the actual name of the hospital isn't attached, but just like the location of the level 2 or level 3 or whatever, just so everyone kind of has an idea of, in their region, how many other level 3s or level 4s or so be it are in that area?
No, we will not be sharing that. So the data is shared with each individual hospital. We'll be able to see that here, but we're not going to be promoting that or publicizing that. Like you said, you can kind of look at a map in Virginia and say, you can pretty much figure it out. So we don't want to unveil that mask of anonymity, because we really want to encourage you to do it for your own internal self-improvement.
Okay, thank you.
Yeah, you bet.
Sorry, just a quick question, kind of pinging off those two, one from Jen and one from Chris. Carla, are there examples in other states where hospitals in a particular region have chosen to share their results just to improve collaboration or smooth transfers or better understand what services are available, not publicly, but just across their teams?
Yes, absolutely. I've noticed in several states, especially where like the PQC is heavily involved in implementation, there's definitely some kind of more internal conversations. We have several states, Montana coming to mind. Montana published a really nice locate report. Oh, sorry, can you guys hear me okay? Okay. Montana published a really nice report that's publicly available. I could drop the link if you're interested to kind of have how they've used locate, and they've spent a lot of time like on transport agreements, recognizing, it's a very rural state, and they have a lot of critical access hospitals, and making sure that people, for example, know where the nearest higher level maternal care facility is, a higher level NICU, and the hospitals really working together, because when somebody shows up in labor in an emergency room and the nearest appropriate hospital several hours away, you have to work quickly. So yes, is definitely the answer. I think, and then, in some of the smaller states, we see that as well. So basically the short answer to your question is yes. I think it's kind of that relationship building and, people seeing this as like a mutually beneficial way to improve health outcomes for populations.
I dropped the question in the chat, so if you're eating your lunch and you want to respond over there, but I'd love to know, what other hospitals, a lot of you are here, where you are in the process. Also curious if you're having if you had any questions or issues with selling leadership on pursuing this, or anything else that we can help clarify. So if you've got a second to drop in the chat what your status is, you're moving forward, you're in data collection, you're not sure, or any hurdles that you've experienced.
Sorry, one more statement, one more question.
Keep them coming, Jen.
Yeah, we did. I did start looking through it and started to, collect the data and answer the questions. And this is a very specific question, so I apologize. I don't know how helpful it is for the whole group, but for the one question about physician OB leadership, I know everyone's, management structures is probably, they're probably different across the state, but is there like one specific person that refers to? Only because, you know, we have like several physician leaders and I wasn't really sure, you know, if that's kind of up to us to decide or.
Yeah, I want to make sure I'm looking at the exact same question as you. Let me see if my computer will cooperate real quick.
Sure, yep.
Are you talking about is the physician obstetric leadership a board certified or board eligible obstetrician? Is that
Yeah.
the one you're referring to?
Yeah.
Okay.
Exactly it.
Yeah, I think what we're trying to get at is kind of however your hospital is organized, is if there's like a like chief of OB or something kind of equivalent, that person is either board certified or board eligible as an OB. So if it's like chief of OB or director of obstetric or director of L&D, something along those lines. Does that answer your question, or was it more specific than that?
No, I think that's it. And just, we were kind of wondering if it's like, you know, there's obviously like what we have as a chairman, and then there's several physician leaders that are over the whole department, but they obviously fall under the chairman. So we weren't sure if that applied to the chairman or, you know, if it was also inclusive of the other OB leaders.
Yeah, I would say this is trying to get at, like, is someone in OB leadership,
Hmm.
an OB themselves?
Okay. All right, thank you.
Absolutely. Kelly, I don't know if you want to respond to Dane's question in the chat, or if you'd like me to start about sharing is related to the Title V block grant.
Thank you. Look, information we shared. Dane, I don't have enough information on the block grant and the specific performance measure, but happy to talk with you more offline. Carla, if you're more familiar, please feel free to answer.
Yeah, I didn't know. Is Virginia, Dane, I don't know if you or anyone else on the call knows, I think you're referring to National Performance Measure 3, which is the risk appropriate care measure. Is that one of Virginia's like reportable national performance measures?
Not for this current cycle, but it's definitely on our radar for sure for the
Yeah.
next.
Okay. Yeah, that's helpful. So I will, just to be totally transparent with you, I work very closely with HRSA, and we've been having some conversations about how the data for that like might look. So I would say you maybe, if for the next cycle, if you do pursue that, I suspect there might be like updated guidance about kind of where the data should come from, if that's helpful. So but I'm really, it's great that Virginia is participating in Locate, because, you know, it can provide some helpful information about, you know, how many, for example, the national performance measure currently, it's like trying to understand level 3 and higher NICUs. So hopefully Locate will be helpful, but I think that you'll receive updated guidance.
Thank you.
Yeah, we will not be in a position, and again, just to clarify, to be able to give the results directly to the state in order to pursue that. So I think that maybe that's where that more updated guidance is going. I don't know, Dr. De Silva, if that's like, if it's self-reported from the hospitals, and then maybe that means that they'll have the information to convey. Is that the idea?
Yeah, it may
Or just
be.
stay tuned.
Yes, I think stay tuned
Stay
is
tuned.
probably,
Okay.
yeah.
Okay, got it. I like you're thinking one step ahead. We've got a great brain trust on the call here today, so I'm happy to answer any other questions or.
Yeah, I'll also share, I'm also very interested in hearing if people are having any hurdles or anything like that.
Sounds like it's all going smoothly. I'm gonna take that interpretation. Glass half full over here. Well, as a reminder, the deadline for submission for this round is going to be December 15th. So you can feel free at any point to reach out to myself, Mary Arrowwood at VHHAF Foundation. I believe Mary's name is the official on the list. As any questions you have, direct them towards Mary. We've gotten a couple great questions already, and we've shared those with Carla and made sure to get you the most accurate information and responses in a very timely manner. If this goes well and we have good engagement, we may consider doing another round of locate assessments in 2023, maybe in the later next year, as a chance to kind of reevaluate, see what changes have been made, give you an opportunity to resubmit. So again, this is an internal quality improvement tool. We hope it's useful to everyone. We never want to give you a, I'm not going to use the word survey, but an assessment just for the sake of assessing. This is truly with the intent of helping you wrap your arms around your own data, benchmark against your peers, and help kind of raise the level of maternal and neonatal care in the Commonwealth. If there are no further questions, we'll go ahead and let you enjoy the rest of your afternoon. Carla, thank you so much for being here and for all of your support through this process. We're really excited to be moving forward and couldn't do it without you.
Thank you. And I'm really sorry for all my tech issues, but I'm happy to answer any questions if they arise.
Thank you. And Lindsay, thanks again for the support as well. Carla, you are truly a method actor with being pregnant while running the locate assessment for us. So thank you very much. With that, I'll say thanks to everybody. Hope you have a great afternoon. I appreciate our partners over at the state. Good to see you all, and talk to you soon. Bye.
Thank you.